The role of home care in emergency, disaster, and evacuation planning. Home care agencies can be a fundamental foundation that can support the traditional hospital health care system during a time of disaster. However, they should be able to function utilizing their inherent strengths and existing care delivery structure. Home care agencies already perform activities necessary for effective emergency planning, such as assisting hospitals when at surge capacity, providing community-wide vaccination, participate in community outreach programs to disseminate public health information, and educating patients on disease management. In addition, their ability to deliver health services to individuals in non-structured environments without additional training makes them ideal as care responders in times of crisis. With respect to preparedness and response to disasters affecting the public health, it is critical that home care and hospice agencies' infrastructure be strengthened, and that the special qualities and abilities of these health care providers be utilized. As a service performed primarily in individual homes in the community, home care and hospice are essential to disaster preparedness and response efforts. Today, home care is the only system that is oriented to the community in a broad enough way to provide a massive infrastructure. Through the home care and hospice agencies in this country, it is possible to put a nurse in every zip code. In fact, in many counties in this nation, the public home care agency is the sole community provider. The home care nurses are well acquainted with their communities to the point that they can be quickly deployed. The home care nurses of today are trained in community health service. They are able to assess the patient's symptoms as well as the environment in which they reside. They conduct patient and safety assessments, skilled care and treatment, educate patient and family, monitor and instruct on infection control practices in the home, and assist with medical and social supports that are critical to the process of healing the sick and protecting the well. Today, these skills are essential to serve and protect our community's health. Home care providers need to be classified as essential health care workers and be provided such considerations as gas vouchers, official identification cards or papers, access to restricted areas, and access to alternate communication systems. As such, home care providers should be included in emergency and preparedness response programs and be allowed greater self-determination regarding their contribution to emergency planning and response initiatives. To utilize home health and hospice providers as only support systems for other health care providers during emergencies would not be an efficient use of a valuable resource. In every emergency or disaster, these statements will always apply. Local governments are the first to arrive and the last to leave. Local governments are responsible for the community. Local governments are in charge. Local governments have resource limitations. Individuals and families must make emergency and disaster plans and review them periodically. Institutional and community-based healthcare agencies must plan for emergencies and disasters in a uniform manner and then take steps to integrate them into the local government planning efforts. Emergency management, personal and family preparedness, and agency planning is a system of local, county, state and federal, and private resources organized to mitigate, plan for, respond to and recover from emergencies and disasters.